Hi, my name's Natasha Rooney, and I'm a PhD candidate at Deakin University in Melbourne, Australia. The title of my presentation today is Ayurveda and Epigenetics, Preconception, Biological Plasticity, and the Reconception of Health Narratives. Epigenetics and Ayurveda at first seem like unlikely counterparts. The former is a budding field of science which explores how environmental influences create changes in gene expression. The latter is an ancient Indian science and traditional medical system with associations to the Hindu religion. However, when it comes to their social and behavioral implications, the two are finding common ground, particularly around notions and practices of regulation of the maternal body. An international online conference on Ayurveda and epigenetics was held in 2020, exploring the many ways in which the two fields could be linked, with pregnancy being one of the key foci. As I watched each presentation in 2020, it became apparent that to many of the presenters, the message of epigenetics was nothing new. Indeed, many claim that Ayurveda, a medical system established around 400 BCE, has worked alongside an epigenetic framework for centuries, and that modern science is finally validating what Ayurveda has always known. Parents, and particularly mothers, were encouraged to take part in responsible reproduction in many of the presentations by making sure to prepare their bodies prior to conception. Presenters on the topic of pregnancy claimed that by subscribing to preconception protocols, parents could create epigenetic influences on their child in various aspects of their physical body, personality, and intelligence. These claims parallel those of Ayurvedic ashram-style preconception centers that offer ideal progeny to parents and have been reported on by Indian newspapers. Researchers claimed that the environment could not only impact your health, but also impact your children and grandchildren's health through transgenerational mechanisms. This epigenome, often described as flexible, responsive, porous, plastic, and bringing together multiple generations, is reviving an interest in these traditional medicines like Ayurveda. So referencing the developmental origins of health and disease, or DOHAD theory, which explores how maternal experiences can influence epigenetic changes, presenters at the conference stressed the connection between Ayurveda, epigenetics, and preconception. And this preconception period has become a site of renewed interest in public health. Recently, the emerging field of research is offered as an opportunity to strengthen health outcomes for mothers and children. However, it often neglects men within the scope of this preconception research, and not to mention other genders that are also capable of reproduction as well. So this poses questions about the gendered nature and behaviours surrounding preconception research, and the central focus on women in the preconception period can be seen as beneficial for delivering healthcare interventions to more women, but also has its consequences in reducing women or even girls to the roles of mothers or potential mothers. So this places a large burden on her actions before, during, and after pregnancy, and places the mother at the centre of responsibility for producing a healthy, or even in some cases, an ideal progeny. In one of my recent interviews, an Ayurvedic doctor asked me, why wouldn't a mother want a baby that's better than her? Better a baby by choice and not by chance. At the same time, the concept of an ideal progeny is not universal, but contextualized within historical, social, and political narratives. Indeed, everyday lifestyles and actions, which are the bread and butter of the epigenome, offers a new foray into the conception of normativity and what is considered normal in given populations. Unlike the reductionist view of generation in genetics, it has the potential to revive or reconceive health narratives relating to women as a site of biological impressionability. Thank you very much.